Hello viewers, welcome to another episode of Core Bank's Pump It Up video series. I am Patricia Hagley, your host. Today we will be discussing the importance of mental and emotional health and how it impacts our overall well-being. Our panelists are Josh Hector and Dr. Kecia Lowe. Josh Hector is a counseling psychologist at Optimal Solutions and is part of Core Bank's Employee Assistance Program. Dr. Lowe practices internal medicine and pediatrics at Brooksmith Lowe Institute, which is the home of Spice Harmony Yoga Studio, where she is also an instructor. Our panelists are advocates for holistic mental and emotional health. So, let's have some healthy discussion. Dr. Lowe, what is mental and emotional health? Are they separate topics or are they related?
Well, they are related. Mental health has to do with how you feel and how you think, and emotional health has to do with your feelings and what comes up as a result of your thoughts.
Okay, Josh, you wanted to add anything to that?
Of course, because thoughts become feelings. We seldom feel in isolation of whatever we're thinking, which means that positive thought would result in good feeling, and similarly negative thoughts would also result in bad feelings. So thoughts become feelings, which ultimately become behavior.
Thoughts become feelings, which ultimately becomes behavior. Let's just touch on mental illness. What causes mental illness, and like depression or anxiety? Can emotional trauma be a factor, or is it just a chemical imbalance?
It's a bit of both. You have some instances where stress comes up as a result of a situation, and you have instances where we are stressed because of chemical imbalances in our brains. So there are instances where we have emotional or mental rather illness being caused by a biological factor, and then in some instances it would be circumstantial.
Dr. Lowe, would you like to just add a little to this?
Yes, I think it's also the reaction, how you react, how you interpret what's happened to you. So when you have trauma as a child, if you don't have the support and counseling and things to deal with it, then you can internalize it and it can come out later on as, serious mental problems.
So are there any specific symptoms for mental illness?
Well, yeah, there are a lot of symptoms of mental illness. I mean, just anxiety, constant worrying, inability to function, inability to participate in your family and your community and school. All of those things can definitely be signs of mental illness.
Okay, you touched on family and inability to function. So does family members and loved ones, can they identify mental health issues in someone they love?
Well, I mean, they can suspect it. I mean, they're not clinicians or counselors, but they can definitely notice, hopefully, that something is wrong. The person may not be acting as they normally do, and they can maybe notice withdrawal and not being as, open and communicative. They may notice the person is sleeping more than usual or suffering from insomnia, which is the opposite, where they can't sleep. They may be eating more than usual or maybe not eating as they normally would. So a lot of the behavioral things that are normal for a family member, if they start showing major changes, this can be red flag that there could be something wrong.
So Dr. Lowe, let's just touch on the correlation between mental illness and substance abuse.
Well, I think a lot of times substance abuse can be seen as a way that patients try to make themselves feel better, like self-medication. Right. So these people may have a lot of negative things going on in their lives, and in an attempt to make themselves feel better, a lot of them just get lost in the temporary, supposed temporary relief of these substances, not realizing they're making their problem way bigger in the long run. So I think substance abuse definitely can be something seen as a red flag for deeper underlying problems.
We focus specifically on substance abuse, and as you said, you may not actually see specific signs, but tell us still, from a family's perspective, what would they be able to identify as specific signs for persons who are, have little issues with substance abuse? What are the specific signs they should look out for?
I think sometimes a lot of the signs are very similar to what we were talking about with depression. And sometimes these people, you notice that they're now dependent on the alcohol and or whatever substance, and sometimes they become tolerant, so they have to actually use more of the substance to get the same quote-unquote relief.
Okay.
So there's a tolerance, and they tend to, it becomes a crutch for them,
Okay. So we'll touch a little on support mechanisms and the importance of the family structure. And how can family members really employ or help someone with a mental health problem? Okay, you notice the situation, we notice certain signs. How can the family be a major support to someone going through that issue?
The first thing I would say is that the family definitely needs to be patient. And patience is a virtue that is difficult because you need patience to learn patience. But they have to understand that whenever we have substance abuse, what a substance does, it really hijacks the reward mechanism in a person's brain, so that nothing is enjoyable apart from that specific substance. And they are now in a situation where their bodies actually crave this substance like it would food. And so the family has to understand how addiction works and be patient with this individual, minus judgment, minus criticism, because really and truly the person is not in control of themselves.
Dr. Lowe, what is the collaboration between psychotherapy and medication to treat mental health disorder? And Josh, you can come in as well when Dr. Lowe finishes with her response.
Well, I mean, psychotherapy, as Josh had said earlier, is talk therapy, where you're actually talking to the patient. You're discussing with them the situation, how they feel about the situation, their emotions, how they're responding, and how they're seeing themselves in the whole situation, right? And then medication now helps with the neurotransmitters in the brain, because a lot of times depression and anxiety have to do with imbalances chemical imbalances in the brain of the neurotransmitters. So the thing about the medication, sometimes it takes it takes a long time to really start to see changes in the balance and trying to rebalance those chemical neurotransmitters. So the psychotherapy is crucial to be there as part of the treatment, because the psychotherapy has usually a faster effect, or at least it begins to start giving the person support. And so that, in conjunction with the medications that do usually take a longer time, work together to get this patient back on track.
Okay, you mentioned, we spoke initially about emotional health. What specific activities, Dr. Lowe, can a person battling with mental health challenges use to recover?
Well, I mean, that's a really big question, because you see, I think mental health is such a broad thing that it's hard sometimes to give you a cut and dry answer, because it just depends. There's anxiety, there's panic attacks, there's depression. It's really hard to say which of the, But I think that a lot of times they can just begin to get in touch with themselves, use mindfulness, build up their support networks, their coping skills, taking time out, journaling, being in touch with others. Some people, depending on what the issue is, you can join different support groups. They have support groups, not as many in Grenada as would be, wonderful, but we just don't have that here yet. We're working towards that, but there are a lot of virtual support groups that you can join as well to get that support. But it's a complicated thing, because mental illness, it just depends on which of the, it's not just a cut and dry type of thing.
You mentioned mindfulness, and just talk to us about mindfulness and being intentional about our mental health. What and how does that work? Just let us zero in on mindfulness and just talk to us a little about that.
Well, just what you did is so interesting, what you did, because that is a whole thing about being mindful and being in the moment. We were having a conversation earlier about distractibility and not being in the moment. And when you're in the moment, it's really very difficult for you to reflect on the past or anticipate the future. And so when you're being mindful, you're in the moment, and you are less likely to be anxious or depressed, because you're practicing being here now. And it also, when you're in the moment, you're breathing deeply and you're actually giving your body, your brain, the subconscious message that everything is okay.
Right.
The body can relax, and that fight or flight response that we usually, have in response to stress is tampered down. And so when you do this mindfulness regularly, it actually can change the structure of the brain. It can actually increase the gray matter, and it can, and cause increase in neural synapses and junctions and development, and so you become a little more capable, you become more able to focus, more able to just let the stresses of the day just come off you. Just, you don't take everything personally. You have more patience, more self-love for yourself and for others, because you are just in the zone.
So you, as a yoga instructor, mindfulness is very important to you, right? And how can mindfulness help persons to be in tune with their emotions? You touched on it, but just, it seems like it's not as important in Grenada, and we want persons to be mentally healthy as well as physical. So just talk to us a little about that and the importance of overall well-being.
Well, yoga is one way. There are many ways, but yoga is one way to really give yourself the time and the self-love. You're being kind to yourself when you go on your yoga mat and you're spending time with yourself. Yoga has to do with the union of the body and the mind. So you're becoming one. You're focusing on yourself and your needs. You're stretching the body. You're taking deep breaths. And it's just a way of showing your own self-love and patience. And this now ripples off into your everyday life. How you deal with others, how you deal with yourself, maybe your shortcomings. You're not as hard on yourself, and it also helps you to develop concentration, because in yoga you do certain things where you spend time concentrating, and so that will also spill off into your everyday life.
And you, I'm certain, is an advocate for that, the importance of emotional health and well-being. What coping mechanisms can we all use to manage stress or stressful situations, such as the pandemic and the impact it has on us?
Well, I think, that health and wellness in terms of eating well, sleeping well, stretching, exercise, all these things, maintaining your relationships with others, your family members and your friends and co-workers, keeping that connection. We're social beings. Notice I didn't say social doings. We're human beings, and a lot of times we don't have the opportunity to just be. Many times we're so much on the go that we just forget, we just lost in our thoughts. The average human being has about 3,000 thoughts per minute, and on top of that, 47% of those thoughts are not on what the person is doing. So 47% of the time, your mind is either in the past or the future. It's not in the present. So these thoughts are just running rampant in your head, and it just hijacks you.
And that's why it's so important to keep that positive thought always. So Josh, tell us a little about that.
Well, the mind is such a powerful thing. And I usually use this analogy: you're not going to sharpen an axe and chop yourself with it. Right. You'll use it to clear the path to cut down trees and clear a path in front of you. And unfortunately, we have this inside job that is so common, where people are sabotaging themselves using their own minds. There's an old Turkish proverb that says the fish rots from the head first, which is actually literal. But when you look at the analogy, it really means that if your mind is not pointed in the right direction, everything else tends to follow. And so we have to know, take charge, take hold of this powerful tool that we've been given and use it to our advantage and not to harm ourselves. Meditation is powerful. I actually meditate at least once a day. I just take my shoes off and lay on the floor for about 10 minutes and just bask in nothingness, because we are bombarded by, information is coming at us. Sometimes we distract our own selves, and then there are other times when even minus our input, information is coming. So meditation provides an opportunity for us to let go of the noise and just be calm and look within ourselves.
You touched before on the importance of being positive. You with your family, and always the child does something wrong, you speak positivity into the situation if you can.
Yeah,
Touch a little on that.
I was saying that when you have a child, or even other people that you have relationships with, if you see them doing positive things or things that you like, or you want to have them do more of, if you compliment them and really focus on those things, you'll get more of that behavior. Same opposite to that is if you, like, we tend to focus, like it's a survival strategy to focus on the negative. We tend to remember what's wrong and not what's right. For some reason, that's part of our survival mechanism. And so if you're always harping on the negatives, you're nagging, whether you're a nagging partner or a nagging parent, it just is a turn off, and you will get more of what you are nagging about.
Exactly.
So, but if you focus on the positive, catch them. You can always catch somebody doing something good. Make noise about it. Praise them and give them positive feedback, and you will be amazed at how you will get more of that same behavior. So this is something we need to be aware of.
Do you think it's a culture change that needs to happen? Because sometimes persons can be so negative. How can we change that?
I think it's actually bigger than a culture change, because as Dr. Lowe was saying, as human beings, we are predisposed to pay attention to that which is negative. If you walk through a room and 50 people say hello, and person number 51 is mean, you're going to remember person number 51. So that unconsciously, when you see person number 51 again, you know how to behave to protect yourself. So, it's actually a survival mechanism. But we have to be able to switch that off when we don't need it. We don't always need it, and sometimes we use it when it's not even necessary.
How can we do that effectively?
Mental rehearsal.
And that goes right back to meditation.
It goes back to meditation. It also goes back to regulation of thought. Because as much as we're talking emotional well-being, there is no emotional well-being if cognitively we are not well. First of all, if our thoughts are negative, it's going to spill over. So the emotional well-being is regulated by the things that we think. And what's interesting is that the bulk of our thoughts, at least the significant ones, not the fleeting ones, like I walk into this place for the first time and I go, okay, that thought comes and goes. But we have thoughts about ourselves, thoughts about our careers, about our health, about our future, about our abilities, whether we're good enough or not. Those thoughts tend to be reruns. If you think of it, some of those thoughts, you may have had them this morning, and you had them last month, 2 months ago, last year, 2 years ago. If those thoughts are negative, they linger, and they cause a negative ripple effect, so that your mood is affected and your behavior.
There are situations where, okay, today I've made a decision, today I'll be positive. You go to a specific environment, you hear negativity, you're just in a situation where it's difficult for you. Dr. Lowe, how can we best deal with situations like that, just to stay positive in a negative environment?
Well, I would recommend you breathe deeply and you just stay in the moment, and don't make their story your story. Don't make their story your story. Try to just not embrace it as your story. Person number 51 didn't say hello. Maybe she's having a bad day. Maybe she had a fight with her partner. Maybe she's having pain. We don't know. Don't make it your story that because person 51 didn't say hi to me, that, oh God, she's not very nice, and
And right away, as Josh said, you take it as if it's your fault. Yeah. Did I do something, and start blaming yourself?
Yeah, which is a normal reaction, but we need to now rise above that and just give the person the benefit of the doubt and just move on, and don't make it your story. Leave her where she is and go to 52 and number 52, and don't even look back at 51. Exactly. So I think when we start to get really in the muddle and taking everybody's story as our story, that's when we get into trouble. Just focus on yourself, breathe, and just be mindful. I mean, I guess it's when I say that, I guess it might be hard for some people to understand what I'm saying, but just focus on your breath and being here now, and don't embellish all the thoughts that are in your head about whatever. When you hear the stories, when you hear people, you don't have to participate in that tebe and thing, just smile and move on and go do what you have to do. Don't get into it.
And especially remembering what your goal, your outcome is, your main goal, and just trying to remain positive.
And if you fall off the wagon, suppose you just can't resist to say a little thing, a little tebe thing, you can just realize and shut up, cut it right there and just move on.
And that's what it goes right back to mindfulness and being in tune and knowing how to deal with certain situations.
Yeah, we're not perfect. So if it happens that you just give in a little bit, just, step back after.
But there are persons who can be so negative. It's true. Yes, how do you deal with situations like that? And you trying to be emotionally healthy. Josh, tell us.
Truthfully, let me start by saying that leaving is always an option. Like you do not have to sit in a space where people are negative and harping on about all that is going terrible in the world, if that is not what you want to hear. Because if you stay there long enough, it is going to have some level of impact on you. So leaving is fine, but then at the same time, we have to remember that a person who is being negative is, what we're seeing is really a manifestation of either a challenge that they're having, or it may be a personality issue. Let's not take it personal. Okay. Let's not hang on to it as if it is directed at us specifically, when this person may just be being themselves, and anyone who sits where you sit would get the same type of reaction from them. So don't take it personal.
Okay. Dr. Lowe, tell us a little about sleep and the importance of sleep.
Well, sleep is a crucial thing. It's an evolutionary thing. It's something that we have to do no matter whether we want to or not. And it's the time when the body rejuvenates itself, it heals itself. So it's really, really an important time to make new connections in the brain and all of that, so the brain gets a rest. I mean, it's true that we have dreams and all that, but it's also a time of just rejuvenation. It's really important. And I think a lot of people don't realize the importance of sleep. They just take it for granted. They'll sit up in their chair and then eventually fall asleep at whatever time, the TV watching them, then they get up and then they have to go get ready for bed. And it's, we have to have something called sleep hygiene, where we're creatures of habit, whether you realize it or not. And so to get the best benefit of things, it's good to do things consistently, whether it's sleeping, whether it's exercising. We need to be consistent to get the best results. So sleep is crucial, at least a minimum. I mean, a lot of people claim they don't need a lot of sleep, but in the end it catches up with them. So I would say at least minimum 6 to 7 hours, depending on your age, because as you age, you may need less sleep. But in general, I would say at least 6 to 7, all the way up to 9, 10, depending on your age and stage in life, how fit you are, all these things.
And adequate sleep does lead to healthy
outcomes, definitely.
Josh, you hear all the time people talk about, I'm not a morning person. Touch on that for us and tell us exactly what does that really mean?
Well, as Dr. Lowe just said, we are creatures of habit. What that person is communicating is that they've habitually gone to bed too late, and they've trained themselves to wake up late or be cranky when they wake up because they have not slept enough. Anyone can be a morning person. Anyone. As contrary to popular belief, you can become a morning person if you adjust your sleep habit.
So let us just reiterate as we wrap up this lovely discussion here. Let's just speak to us about the importance of, yes, it's important for physical health. Just touch a little on the importance of mental and emotional health as we wrap up the discussion.
Mental and emotional health. Why are these are so important, and I would even just group that up and say mental health, because for any individual to have a good bill of health, physical health is not enough. Your mental health has to be in check as well, because if you're physically well but your mental health is poor, you are not a healthy individual. Because those two are, you have two sides of the same coin that have to work together in order for holistic well-being to take place. So this is the importance of mental health.
I agree 100% with what Josh says. And I think that by having these kind of discussions where we open up and we tell people what are they looking for in terms of good health, then they can see if they're lacking, they can reach out for help. expressing their feelings is something that we really don't take into consideration, the importance of being able to talk and express your feelings and, discuss with your family members or your friends. I mean, there's some people who claim their family, they don't get along with their family, that's fine, but your friends are the family that you choose for yourself. So if you have friends who love and support you and that you love and support, you can talk to them about your feelings and get that support, get that communication, that network. Because when you have your ups and downs, you want to be able to have, support in place. So it's really important.
Thank you, Josh and Dr. Lowe, for your insight into mental and emotional wellness. We appreciate you joining us on this episode. You were a wealth of knowledge. Thank you so much.
You're welcome.
We'll now take a short message from Flo, one of the Renaissance benefactors who has been supporting the re-establishment of the Carlton Home Initiative.
Hello. Flo is really proud to have been an initial benefactor in this initiative to restore the Carlton Home. Mental health challenges, along with substance abuse, has been well documented as part of the chronic health problems in our society today. As such, it was about 4 years ago when the Grenada Co-operative Bank approached Flo, Hubbard's, and Guardian Insurance to join in this initiative to really make a difference in our society. I'm really happy that years later, other benefactors have come on board, other corporate sponsors and other individuals around our society have joined with the Grenada Co-operative Bank to really make this the success it's been. I really look forward to building more on this foundation that we've set and really and truly to the benefit of some of the most vulnerable in our society. The Pump It Up brand surrounds encouraging our public to make healthy choices, healthy lifestyle choices. Flo is in the business of connecting our communities and providing them with information, which is a key ingredient in making some of those choices. As such, we really believe that our objectives, our mission of transforming our communities to be healthier is really aligned to the Pump It Up brand, to make healthier choices for the benefit of our lives. So I think really this is something we're happy about. We're aligned in the missions of our brand and the missions of the goal of the Pump It Up brand. And as such, we continue this fruitful relationship. The benefits of this program are to build awareness to this problem and to share the right information with our general public. A society that is informed makes the best decisions.